So overall, the study is very encouraging for women suffering and for their doctors who are trying to help them. And it's very reassuring for the patients who are suffering and having their sex lives ruined while they're taking strong medications that keep their breast cancers from coming back. Hello, welcome back to Gyno Info, or if this is your first time, just welcome. I'm so glad you discovered us. In this podcast, we will discuss common gynecological problems in a frank and open way that the normal everyday woman can understand without a medical dictionary. When I was a very young doctor, one of my professors once made a really snide remark about most doctors out there practicing at a level about 5 years out of their training and not learning anything new after that. I was just about as horrified as you probably are from hearing that. And I also decided this would never happen to me. This guy was rather exaggerating, probably, and super arrogant, like a lot of my professors at Harvard. But I swore this wasn't going to be me. Actually, nowadays, you have to prove that you're up to date. There's something called continuing medical education, CME credits, that every doctor who wants to maintain their medical license has to prove that she actually did. Otherwise, you lose your medical license. So you can be reassured it's not like it was in the olden days. But anyways, in my efforts to stay up to date, I spent last weekend studying some recent articles from the medical literature. It was no hardship for me to study over the weekend because I just love gynecology and I find it more interesting than just about anything else I could be reading about. And now I want to share one of those articles that I read. It was very exciting and it appeared in the American Journal of Obstetrics and Gynecology in the March 2025 issue. The article I want to tell you about and that I studied this weekend is about the use of vaginal estrogen for the treatment of genitourinary syndrome of menopause, also called urogenital atrophy or atrophic vaginitis in women who are breast cancer survivors. Urogenital atrophy refers to the thinning of the vaginal and outer genital tissues, the labia, and the lower urinary tract, and the bladder and the urethra, which is the tube from the bladder to the outside. And this results from loss of estrogen. Most women won't use those fancy terms, but they will just talk about what they're feeling, what their symptoms are. If the vagina has no more estrogen, it loses the nice thick lining and the accordion folds that stretch with sexual excitement. The vagina gets longer and wider to accommodate a penis or a dildo. And when you lack estrogen, the wall gets very thin. And instead of having nice little folds, it's just a thin, very thin line, and it doesn't stretch anymore. So it's too short, and it doesn't stretch lengthwise, and it doesn't stretch in width. The bladder symptoms of having to pee all the time, of having no control of when you pee, that the bladder decides it wants to pee, not you, is called overactive bladder syndrome. And it's also often due to lack of estrogen. Those are all miserable symptoms, and they ruin lives, and they ruin sex lives, and they ruin relationships. And women grieve for their loss of vaginal health, and they grieve for their lack of your control over their bladder and urinary incontinence. And it's miserable, but something can be done about it. Loss of estrogen is the key, and loss of estrogen can have many causes. It can be natural menopause. It can be surgical menopause because somebody takes out the ovaries if they have cancer or other benign tumors that destroy them. It can be chemo-induced menopause. Chemo for breast cancer will destroy often the function of the ovaries. It can be radiation-induced menopause, also as a part of cancer treatment. And it can be even treatment with anti-estrogens, for instance, aromatase inhibitors. Those are medications that are used to block estrogen action in women who have a breast cancer that likes to eat estrogen. And so by blocking it, you can decrease the chance that the cancer comes back after treatment. These are the so-called estrogen receptor positive breast cancers, the one that respond to estrogen. Not all of them are estrogen receptor positive. Some of them are estrogen receptor negative, etc. We can go into that in some other episode. But because a lot of breast cancers respond to estrogen, the FDA has said you should never give estrogen to a woman who has had breast cancer for whatever reason. And this contraindication makes logical sense because some breast cancers do like estrogen, but it leads to enormous amount of suffering if you stick to these absolute contraindications in the FDA package inserts. Now let me tell you why this study has me so excited. It basically validated what many doctors, myself included, who are taking care of breast cancer survivors have been doing for many years, and also what the American College of OBGYN recommends, that if other methods of vaginal lubrication or bladder medications don't do the trick, you can give vaginal estrogen in low doses to women who have had breast cancer in the past. You discuss the risk of that with the patient, and most often the patients are so miserable that they choose to take it. Now we can do that with a better conscience because this new study actually looked at a whole bunch of studies and then looked at what the difference was in breast cancer recurrence rates of the ones that received vaginal estrogen and the ones who received no estrogen at all. They looked at three things. They looked how many women who got estrogen in the vagina and the women who didn't had a recurrence of breast cancer. And they also looked at how many died from breast cancer and how many died overall from many other causes. The study showed that if you use vaginal estrogen in those low doses that are needed to treat vaginal dryness and bladder irritation, that there was neither an increase in breast cancer recurrence, nor was there an increased risk of death from breast cancer, nor was there increased death rates from any cause. In fact, the people who had vaginal estrogen had a lower overall death rate from all causes than women who did use estrogen. So overall, the study is very encouraging for women suffering and for their doctors who are trying to help them. It's reassuring for the doctors. It goes along with what ACOG, the American College, has been saying for a long time. Goes along with the breast cancer specialist doctors have been saying, and is very reassuring for the patients who are suffering and having their sex lives ruined while they're taking strong medications that keep their breast cancers from coming back. But a medical history of breast cancer, in fact, is still an official contraindication for giving estrogen, according to the FDA in the package insert. So giving vaginal estrogen to a woman who's had breast cancer in the past is a so-called off-label use. That means using a medication that is approved for vaginal dryness or for bladder symptoms, but you're using it in a patient that is not approved for that treatment, like a woman who has had breast cancer. But in discussing it with your patient, the doctor and the patient decide they're going to give it a try, even though on the FDA package inserts it says you shouldn't, but there are a lot of good studies that show that it's actually very reasonable to try. Now we have a new study that shows that and shows it more extensively with larger numbers. So this is super exciting and very reassuring. Off-label use always requires that the doctor and patient have a long conversation discussing the pros and cons of giving this medication for an unapproved indication. In this case, estrogen for a breast cancer survivor in a very low dose that is not expected to stimulate breast cancer, but is nevertheless contraindicated according to the FDA. So that is all for now. If you liked this episode, please let your friends know that you liked it and give us a few likes as well. It makes it easier for other people to find us. The more likes we have, the better. And also, please write to me and tell me if you like this whole concept of me doing episodes about interesting articles that get me excited and sharing the information with you. The place to leave that answer is at questions@gynoinfo.net. Again, questions@gynoinfo.net. And that's also the place where you can leave your suggestions for future episode topics and also questions that you'd like me to answer in the Q&A episodes that I do about once a month. So thank you for listening and tune in again at Gyno Info, wherever you like to listen to your podcasts. Goodbye. Until next time, thank you for listening. And remember that you and your health are super important and deserve your full attention. Don't ever put off contacting your doctor because you're scared or embarrassed when something feels wrong about your body. Doctors are here to help you and not to judge you. And also, regular well-woman visits are always a good idea that you should make time for. You deserve it, and you owe it to yourself, and you owe it to your body and your health. This podcast is part of Pride House Media, hosted by me, Dr. Burki, produced and edited by Josh Rosenzweig. Original music composed by Nell Balaban. If you enjoyed this episode, please subscribe wherever you listen to podcasts. And while you're there, leave us a rating and a review. It really helps others discover the show. Stay connected and join the conversation by following me on Instagram and Facebook at GynoInfo and on LinkedIn at GynoInfo Podcast. Remember, any questions that I answer or information that I give you on this podcast are to be understood as information only, not treatment of your medical problems. While I'm a very knowledgeable gynecologist, I'm not your gynecologist who has talked to you and examined you personally and is therefore actually able to treat you. So please consult your own healthcare professional with any medical questions or concerns.